Today we are going to discuss the muscles which are connecting vertebral column with upper limb. These muscles are also called the posterior axio-appendicular muscles. So these muscles are subdivided into two groups. One is the superficial group and one is the deep group. This side shows the superficial muscles which are the trapezius and the latissimus dorsi. And when these two muscles are removed, we see the deep muscles of the posterior axio-appendicular region, which are the levator scapulae and the rhomboids, rhomboid minor and rhomboid major. So basically these five muscles constitute the posterior axio-appendicular muscles, also called the muscles connecting this vertebral column with the upper limb. So we'll discuss these muscles one by one. First of all, the superficial group. It has the trapezius muscle and the latissimus dorsi muscle. Now, the thing we need to understand is that the trapezius muscle is the upper muscle and latissimus dorsi is the lower muscle. So, origin of trapezius muscle is from above and the origin of latissimus dorsi is from below. And in between, these two muscles overlap. So, first of all, we'll discuss trapezius muscle. The origin of trapezius is from the cervical and thoracic vertebrae here. It is inserted into the clavicle, the lateral one-third of clavicle, and the acromion process of scapula along with the spine of scapula, the upper border, upper crest. The action of trapezius muscle is basically the rotation of scapula during abduction of humerus. Now, the trapezius has three fibers, the upper fibers, the middle fibers, and the lower fibers. The upper fibers basically elevate the scapula. The middle fibers here, they retract the scapula, and the lower fibers depress the scapula. The nerve supply of trapezius is the accessory nerve, which is the 11th cranial nerve. And how we can test this cranial nerve? It is by asking the patient to shrug his shoulders. So this trapezius muscle is also called the shrugging muscle. The next muscle is latissimus dorsi. As I've mentioned in the previous slide, trapezius originates from above and latissimus dorsi originates from below. So the origin of latissimus dorsi is from the iliac crest, the thoracolumbar fascia, the inferior 3 or 4 ribs, and the spinous processes of the inferior 6 thoracic vertebrae here. So this entire large fan-shaped muscle is called the latissimus dorsi. At this region, the lower fibers of trapezius overlap the latissimus dorsi muscle. The insertion of latissimus dorsi is on the humerus in the intertubercular groove of the humerus here. Actions of latissimus dorsi are the extension, abduction, and medial rotation of the humerus, and it helps in raising the arm above the horizontal plane. So it helps in overhead abduction. This muscle is also called the climbing muscle or the swimmer's muscle. It helps in climbing and swimming. The innervation or the nerve supply of this muscle is the nerve to latissimus dorsi or the thoracodorsal nerve having root value of C6, C7 and C8. Now there is a triangle called the triangle of auscultation. As we know, any triangle has three sides. The superior border of the triangle is formed by the latissimus dorsi. The medial border is formed by the scapula and the infralateral borders are formed by trapezius. So this triangle is called the triangle of auscultation, and its significance is that we can clearly listen to the lungs with the help of stethoscope at this area, because this area is not covered with the major muscles and the lungs are very audible here. Now coming to the deep posterior axio-appendicular muscles. These are the levator scapulae, rhomboid minor and rhomboid major muscles. So first of all, the levator scapulae. This muscle is the levator scapulae muscle. It originates from the transverse processes of C1, C2, C3 and C4 cervical vertebrae, and it is inserted into the superior angle of the scapula. The action of levator scapulae is it elevates the scapula and rotates it downwards, and it is supplied by the dorsal scapular nerve and the cervical spinal nerve. This red muscle is the levator scapulae, having origin from the C1 to C4 transverse processes of the cervical vertebrae and insertion into the superior angle of scapula. Now the other two muscles of the deep muscles of the posterior appendicular region are the rhomboids minor and major. So first of all, we'll discuss rhomboid minor, that is just below the levator scapulae. It originates from the spinous processes of C7 and T1 vertebrae, and it is inserted at the area of the root of spine of scapula. And the other one is rhomboid major muscle, having origin from the spinous processes of T2 to T5 vertebrae and insertion into the medial border of the scapula. The action of these two muscles combined is retraction of scapula, and they are innervated by the dorsal scapular nerve having a root value of C4 and C5. So that's all about the muscles connecting vertebral column with the upper limb, also called the posterior axio-appendicular muscles. Thank you.